Hello everyone, I'm honored to be here to introduce a modified gel balloon technique for coronary bifurcation lesion. I am Huang Zheyong from Zhongshan Hospital, Fudan University in China. As you know, provisional stenting is preferred for bifurcation lesion, and its key technique is by side branch protection. There are many protection techniques. The gelled balloon technique is most accepted nowadays. Here is the illustration of gelled balloon technique, GBT. A balloon was placed at the oscium or side branch, may be active or passive when the stent put in the main vessel. Then the balloon was removed and post-dilation was performed. Generally speaking, the GBT jet balloon technique is very effective. However, sometimes side branch occlusion will occur, most in two circumstances. The first is at stage of post-dilation. The second stage is side branch rewiring. Here is a case of side branch occlusion and post-dilation. As you see, the marginal branch is open during the passive protection. However, after post-dilation, the marginal branch was totally occluded. And here is another case of side branch occlusion caused by rewiring. The diagonal was open during its active protection. However, during its rewiring, the diagonal branch is dissected and occluded. The JBT is very effective. However, side branch occlusion can also occur due to post-dilation, because post-dilation can cause plaque shift, can cause carina shift, and plaque dissection. So how to deal with this residual risk of side branch occlusion? We should protection side branch persistently, not only at the stage of the stenting stage, but also at the stage of post-dilation. During post-dilation, the gelled balloon should remain at the side branch, and this constitutes the second time of kissing balloon. And so we proposed the modified technique, namely DKO, double kissing inflation outside stent. There are two types of kissing balloon. The first is the kissing between the stent balloon and the gelled balloon. And the second kissing is between the post-dilation balloon and the gelled balloon. Now let's see a case. Here is a bifurcation of the LAD and the diagonal. The diagonal is very large and very important, so we adopted the KO technique to protect it. Firstly, we pre-dilate the LAD and diagonal. Then we put a stent in LAD while active protecting the diagonal. This is the first time of kissing, the kissing between the stent balloon and the gelled balloon. Then we remove the stent balloon. We advance a post-dilation balloon and post-dilate the distal stent, and then the post-dilation balloon and the gelled balloon was inflated simultaneously. This is the second kissing. The second kissing is between the gelled balloon and post-dilation balloon. After the second time kissing, the gelled balloon was finally carefully removed. POT was performed. Another stent in the approximate LAD and LM. Here is a final angiogram, showed good result. And to examine the ostium of the diagonal, we perform OCT both from LAD and diagonal. From here, we can see the diameter of diagonal ostium is about 1.9 millimeter. And so there are three key steps of DKO technique. The first is the first kissing, the second kissing, and POT. The difference between the DKO technique and traditional JBT technique is the second kissing. The DKO technique have the second kissing, the kissing between the post-dilation balloon and the gelled balloon. And here is tips of DKO technique. And between the two-time kissing, the side branch balloon can either inflated or deflated. Inflation or deflation both are okay. At the stage of the second kissing, the overlap of the post-dilation balloon should be least or minimal. This can facilitate the removal of the gelled balloon. At the stage of POT, the distal end of balloon should not exceed the ostium of side branch. So we think DKO may protect side branch better than JBT for bifurcation lesion, and RCT is warranted to confirm its benefit. Thank you.